My name is Pastor Kyle Severson, and I serve as an associate to the Bishop of the Metropolitan Chicago Synod. And along with Synod Council member Pastor Jason Glombicki, I've served as one of the co-leaders for developing the recommendations for physically returning to our buildings for our Synod, which of course we'll get into in far more detail as we go. One note about today's webinar, we've disabled the chat function for this presentation, but welcome you to use the question and answer feature at the bottom of your screen. Pastor Jason, if you'd show that. We hope that you'll wait to submit some of your questions until you've heard most of the presentation, but then we'll have opportunity for any one of the four panelists to respond to those questions. Just a quick overview of what we're doing this morning. Bishop Curry will be centering us in a word of devotion. I'll be explaining a bit about the development of the Restoring Metro Chicago Synod guidelines, including the process, documents we used to support the work, advisory voices, all the voices that we brought into conversation to produce what's unique for us in this time and place. One of those advisors, Dr. Deborah Burnett, Chief of General Internal Medicine at the University of Chicago, will be sharing with us about the state of Illinois' Restore Illinois plan and phases, especially phase 3, of which we're about to enter, as well as ground us in some quality public health information. And Pastor Jason will help us take a dive into the guidelines about how they're structured, how we hope they'll be useful for your congregational leaders as you develop a contextual plan for your congregation. So with that, I'd like to turn this over to Bishop Yehiel Curry to ground us in God's word this day. Bishop?
Thank you, Pastor Kyle. Thank you to all of you who are tuning in at this moment. Typically, whenever I am doing a Zoom call, I would introduce our staff members, our council members, our deans, but today I've decided, just because of time, I won't be introducing all of our leaders, many of which you'll hear from Kyle later, who've helped play a role in this document, but I do want to say thank you for your leadership. Thank you for your time. As we ground ourselves in scripture just for a moment, I want to call your attention to a couple verses that you might have already seen in the letter that came out from myself when we announced the Restoring Metro Chicago Synod document. I'll be reading or focusing on Luke 10:25 through 27. Just then, a lawyer stood up to test Jesus. "Teacher," he said, "what must I do to inherit eternal life?" He said to him, "What is written in the law?" I'm having a hard time. I'm reading from the screen, and I know our thing is blocking here. So let me see if I can pull up the text.
Bishop, I can read it for you if you'd like.
Thank you. Go ahead.
Just then a lawyer stood up to test Jesus. "Teacher," he said, "what must I do to inherit eternal life?" He said to him, "What is written in the law? What do you read there?" He answered, "You shall love the Lord your God with all your heart and with all your soul and with all your strength and with all your mind, and your neighbor as yourself."
Thank you, Pastor Kyle. Just then, a lawyer stood up to test Jesus and asked the question that we've heard a lot today. What must I do? Jesus doesn't directly engage the question. Instead, Jesus asks a question of his own. What's your reading of the Holy Scriptures? The lawyer's reply, love for God, love for self, and love for neighbor. These two questions set up an interesting moment in our parable of the Good Samaritan. Jesus describes the scene. So I know you don't have it for you, but allow me to share a popular text, this Good Samaritan text. Jesus paints a scene and says, I want to describe for you an unknown person. goes down from Jerusalem to Jericho, falls among robbers. This person is stripped, beaten, and left to die. On the opposite side of the street, separately, a priest and a Levite. They see the person, but they continue to walk. A Samaritan who was traveling saw him. Had pity on this person. The Samaritan cleaned up the victim, bandaged the wound, showed some hospitality by assisting with a place to stay and a place to be cared for. The question that I always ask myself is, where do I see myself in the text? And for this moment, I also want us to ask the question, where's the church in the text? But also, how do we show love of neighbor in this text? Because of COVID-19, I want to share with you that in this scripture, in this text that I just read for you, I'm the unnamed person lying on the ground. At the closing of worship of our bishop formation training last July, Bishop Michael Girlinghouse of Arkansas and Oklahoma Synod read this exact same scripture to us before we departed. All of the new bishops were together, and Girlinghouse focused on the first two words of verse 25. Just then. And he stopped. And he questioned the new bishops and he said, this should tell you that something was going on in the text right before this encounter. He reminded us that there had just been a blessing of the 72 disciples who had just returned from their ministry. And just like that, the situation changes. I remember being asked to pay attention to the just then moments when things change rapidly. This is a just then moment. Although I see myself as an optimist or someone who can see a lot of good in situations, some days I feel like I've been robbed and beaten. At times it's been difficult navigating the different expressions of the church. 8 conferences, a committed Synod council, a dedicated staff who still haven't had the appropriate time to gel together, and family matters. Yes, some days I see myself as the person lying on the ground in our scripture. The point I would like to make is that, like me, sometimes we like to see ourselves as the giver, the caretaker, the provider, the good Samaritan. But sometimes we are the ones in need of assistance. I've come to realize I could never accurately see my neighbor if I don't first locate myself in my own story. So I have to be true about who I am in order to appreciate my neighbor. So love your neighbor. You first have to love yourself. It could also mean to see your neighbor. You first have to see yourself. I have to see myself before I can learn to appreciate the police officer in my community or in my congregation. And think about the stress associated with the job and the countless COVID-19 calls. I have to see myself before I can see the EMT worker who's done double shifts week after week, code blues or code reds after code reds. I have to see myself before I can see the nurse who is yet to formulate the words to verbally talk about the trauma. I have to see myself before I can wrestle with the young adults who've never missed an online service, but still checks in every day to deliver our food. Youth who have been frustrated with missing graduation, prom, or the youth group the youth trip that they were finally going to be able to attend. And of course, our seniors who yearn for connection and they want things to quickly get back to the way they've always been. Yet they might be the first ones impacted if there was an outbreak. What if, because of COVID-19, the unnamed person in the Good Samaritan story was not only you and I, but what if it was the church? Not dead, but bruised. Not clothed, but scattered, yet gathered. Today, we will share our faithful response and recommendation for cleaning up the wounds suffered through COVID-19 in an effort to restore the Metro Chicago Synod. We are not dead. We might be bruised. We are not closed, but we are scattered, yet gathered. Amen.
Thank you so much, Bishop. Would everyone please pray with me? The Lord be with you. We give you thanks, O God, for your word, which inspires and challenges and nourishes us. We give you thanks for our bishop, that lens that he brought to this text this day, and especially for the gift of coming together to dream about our new reality, to acknowledge it, maybe even lament about it. Know that we don't do it alone, for you have gifted us to one another, and you continue to walk by our side every step of the way. O Spirit of life, help us to see ourselves and one another during this challenging season. In Jesus' name we pray. Amen. Thanks again, Bishop. I'd like to share a bit with all of you now about how the Restoring Metropolitan Chicago Synod guidelines came to be. As we were living longer into these weeks of stay-in-place orders, the pastoral staff of the bishop's office, Pastor Sunitha Mortha, Pastor Robert Beekman, Pastor Kathy Nolte, and myself began collecting an overwhelming amount of guidance from the White House for the Centers for Disease Control, an awesome document from the Wisconsin Council of Churches. And then Bishop Curry tasked Pastor Jason and I, Jason, who serves on the Synod Council, to develop a resource from this collected information. During this time, though, we also received guidance from the ELCA Churchwide Office and a document called Considering for Returning to In-Person Worship, as well as Governor Pritzker's Restore Illinois plan. We needed a document that took the good guidance that was out there and continues to be developed, contextualized it for churches, and then put it into the framework of our state, Restore Illinois, to engage discussion about what it might look like to return physically to our buildings in each of the 5 phases of the plan. This, of course, was a huge balancing act, balancing the call from leaders like all of you for specific recommendations with knowing that every context, every building, every congregation's demographics are different, balancing science and data-driven knowledge that we know today with the always increasing and evolving wisdom that we're gaining about COVID-19 and best practices, balancing caution in public health with our longing and yearning to be in physical contact, balancing thorough guidance with a resource that wouldn't be paralyzing for our leaders to work with. Throughout the process, we got feedback from Dr. Deborah Burnett, who I introduced before, who's also a member of one of our congregations and has so generously provided regular updates to the Synod staff throughout the pandemic. The Reverend Kathy Bender-Schwick, Chief Spiritual Officer at Advocate Aurora Health, Dr. Gary Stuck, the Chief Medical Officer at Advocate Aurora Health. We spoke with lawyers. We tried to provide the best practices that we've seen, interpret mandates, and then empower you to figure out what is needed in your context. With that brief background, I'd like to introduce Dr. Burnett, again, a huge resource for us in this process, who will help frame the Restore Illinois phases a bit more and explain why this phasing back approach is important. Dr. Burnett.
There we go. Okay, can you hear me now?
Yes.
Good. Thank you so much for the opportunity to talk and be part of this process, which is very important. As mentioned, I'm a general internist. I'm professor of medicine and chief of general medicine at the University of Chicago. I've been working on the south side of Chicago all my adult life, and my job involves patient care, teaching our students and residents, and research in health disparities. I am on the task force that's guiding these efforts within our hospital on how do we reopen our clinics, how is it safe, when do we do that, etc. As mentioned, I'm also a member of Faith Lutheran Church in Homewood, Illinois. So the purpose of this talk is to consider where do churches fit in within the context of our state, and the guidelines we are getting from our state are in turn rooted in evidence-based guidelines from the CDC, the Centers for Disease Control. So my slides will go through those and where are we in the phases that are outlined by our state, and what does that mean for us? Next slide. This is an overview or a map of the Restore Illinois project. You can find many of these slides and graphs on this IDPH website. The Illinois Department of Public Health has current data and very good graphs, very easy to understand. But this is a map of the whole reopening process from phase 1 through phases 2, 3, 4, phase 5. So you can come back to this kind of a page when you're trying to get the bigger picture of where we're at. And just as a preview, we have been in phase 2 recently, and we are just about to move into phase 3. So we'll go through that in a little more detail. Next slide. Just to back up a minute, the governor has laid out that our state for this purpose is divided into 4 regions, and there are 5 phases as we noted over time. We are in the 9-county Northeast region, that's Chicago and several surrounding counties around Cook County. All of the regions in Illinois, all 4 regions, are ready to move now from phase 2 into phase 3. So here's just a recap. Phase 1 was considered that phase of rapid spread when there were high rates of infection and people who were being tested. Of course, we were only testing initially the people who were the sickest, and high rates of people being admitted to hospitals. So you saw the numbers rising steeply. Then we moved into the flattening phase where there are still new cases. This is where we've been the last month or so. Still new cases, but not such a steep rise. We have enough hospital beds and ventilators to care for patients who need that kind of care. And fortunately, we have not been faced with the devastation of Northern Italy or even some of what happened in New York City. And we have ability to test more people in this phase, phase 2. We've been testing people with symptoms, healthcare workers primarily, but now we're moving into phase 3. Next slide. So our governor has stated that this phase will begin on Friday of this week, and there are a number of criteria that allow us to move into this phase. Again, if you look at the Illinois Department of Public Health website, they actually have gauges, like gas gauges. They're very easy to read, and it shows you how we're moving into the green on several different criteria. We now have COVID testing available basically for anybody who needs it or wants it. Patients, healthcare workers, first responders, also people that have other reasons that they want to be tested and know. So it could be people without symptoms, but people living in high risk settings like senior homes and people with underlying conditions. We have more and more tests available, and these will also at some point become available for just people who are in public facing positions. So currently, because we're testing so many more people and not just the sickest people, we're testing people broadly. Now the rate of positivity, meaning out of all the tests you do, only 9% or so are turning out positive in the state, which is good. So the numbers of cases are still going up, but we're testing more broadly, and it allows us to pinpoint sort of where are the hot spots. We also have a falling number of hospital admissions. So my hospital and other hospitals in our area have a lower number of patients with COVID, lower number of patients on the ventilators, and so forth. So we have enough medical resources available, including the protective equipment, to care for patients who need that care. All of those things are good. Those are the things that are allowing us to move cautiously into this next phase called recovery. So we're going to spend most of our time on that, but I'll just mention the final two phases. Phase 4 will not be reached until we do a lot more contact tracing. So when somebody does have a positive test, ideally, phone calls go out. The people that have been around that individual are notified within 24 hours of the new test becoming positive. So those people know they need to quarantine themselves for 2 weeks to see whether they develop symptoms and to protect others. So that's the phase that we're not in that phase. We will need to have a big workforce to do that contact tracing. And I did put that on here because people who are out of work may be interested in this opportunity. It does not require experience. You get a training through an online course at a community college, and the work itself is by telephone. It's not a face-to-face high-risk encounter. So people looking for work, that may be a nice opportunity. But that we're not going to be moving into that phase until we have hundreds of workers trained and out there doing that. That's going to take a while. Next slide. And then the last phase will be when we have a vaccine or when the virus dies out and goes away, when this is really no longer a consideration. So that's a long way off. Next slide. So here we are, as we said, we are just about to move into phase 3. Phase 2 permitted only essential gatherings, and some of the criteria for churches in particular, they used examples of things like funerals, really essential times, but with great caution. No non-essential gatherings were permitted. As we move into phase 3, other gatherings, non-essential gatherings, are permitted, but again, with caution. So gatherings up to 10 people, not 50, not 100. Gatherings up to 10 people will be allowed starting this weekend with precautions, and those are the things you know about: the wearing a face mask, washing hands a lot, minimizing contact, keeping 6 feet away, et cetera, especially indoors. And then phases 4 and 5, are different. More people can gather. Next slide. So similar to schools on the left column and restaurants on the right column, the things that can and should happen in churches are going to be moving into this intermediate phase, which is still a cautious and careful phase. So just as schools and universities are still remaining closed, restaurants and other businesses are starting to open up in a cautious way. Restaurants, it may take a couple more weeks for Chicago itself, but restaurants in at least some parts of Illinois will be allowed to serve outdoors because, again, the virus is transmitted less easily in outdoors open air settings. People will still be expected to wear masks in public, except when you're actually, of course, eating. Restaurant workers would all be masked, et cetera. So very cautious reopening of some other businesses. And then next slide. And so then with churches, we will still be under that guideline of gatherings of 10 or less. Why is this important, and why can't we open up faster? These are the current figures. These are from yesterday. Illinois has had over 113,000 documented cases of COVID, almost 5,000 deaths. That's over a 4% fatality rate among known COVID cases in our state. So the cases, numbers of cases are still rising, even though the rate is slowing down. That's the flattening, but the absolute number of cases keep going up. And we don't have yet that level of contact tracing that will make it safer later on to do broader gatherings. Once we have that, it'll be easier to figure out, who might be at risk, who really needs to stay quarantined, who can go out to a larger gathering. We're not there yet. And in Georgia and in Texas, some of the churches that have opened up for those larger gatherings have had to reclose due to high rates of viral infections and some deaths, including a priest in Texas passed away. Now, here's a couple other points that are relevant and why we need to think about this in terms of caring for our neighbors. The vast majority of people who die from COVID are those who are 55 and older, especially over 65. The rates go up a lot higher. You'll see that age number of 65 listed a lot in the CDC guidelines. Also, other issues that are relevant and justice-related issues. African Americans die at least at twice the rate of whites. In the city of Chicago, it's more like 3 times the rate of whites. There are high levels of virus and cases noted among Latino populations. Also, and this is not entirely explained or understood, but men are also more likely to die from COVID than women at any given age, slightly more likely. So if we were to reopen prematurely to those bigger gatherings, 50, 100 people, et cetera, in our churches, we would raise these risks for everybody, and especially for those groups at risk. More people would get sick and more people would die. Next slide. So here's a couple of pictures. These are from the Illinois Department of Public Health website, but they just illustrate in a very visual way some of the things I just said. And I would look mostly at the slide on the right, or the picture on the right. Even though you can see the numbers of people getting tested and the numbers of people being diagnosed are higher in those middle ages, people in their 30s, 40s, and 50s. That's the left and the middle graphs. But on the right, those are the people who die. Even though the people at younger ages get sick more often, the people at older ages die at much, much higher rates. And especially, again, over 60, over 65 especially, up in the 70s, the risk of death is more around 10%. And by time people are in their 80s, it's a 20% risk out of everybody who gets the illness is expected to die. Next slide. Here's some slides from IDPH that break it out by race and ethnicity. And again, I think that, well, the people tested, so there's a disparity in terms of testing. Some of the highest risk groups don't get tested, or at least initially were not tested as much, despite poor outcomes. And then on the far right, the circle you see shows the proportion of deaths by race and ethnicity in Illinois. The darkest color there represents African Americans, who have a third of all the cases, the deaths from COVID in Illinois. However, it's a third of the deaths, but African Americans only make up 14% of the population in our state. So it's over, people who are African American are more than twice as likely to die of COVID. Next slide. And here's the slight disparity I mentioned earlier for men versus women. Again, it's the disparity is in death, which is the third circle on the right. The darker color is men, and they die at higher rates than women for maybe a variety of reasons we don't understand entirely. Next slide. So when will larger gatherings be safe? As mentioned, the cases are still rising, even though it's slowing. Stay at home has worked. We have actually done a very good job in our state and in our city and cities. So we have avoided what happened in Northern Italy. We have avoided to a great extent what happened in parts of New York City. We have been able to care for people because we didn't have a crashing rise. We had a rise, but not as dramatic as we feared. And that's because we stayed home. It's worked. So we are ramping up the testing now. The next step is we need to do a lot more of that contact tracing. We need to build the workforce so that we will be very careful about finding cases, keeping people safe when they have been exposed. And when that happens, when we are able to do that really, really reliably, then we will be able to expand to more than these small gatherings of 10 people. But that's going to be a while. That's going to be a few months. Next slide. Here's one other thing, is if you didn't have enough to think about, Legionella is a bacteria that grows in stagnant water, including in water pipes, water fountains, faucets. When it's there and when it's ingested, it can cause pneumonia and death. This is the cause of Legionnaire's disease that you've heard about. So while our churches are closed, somebody needs to be going in there and running the faucets and the fountains at least 5 minutes, 3 times a week to prevent the growth of this. You can't see it, you don't know it's there, but this is a simple thing you can do to prevent it. This is not related to COVID, but we also need to take care of this. Next slide. This is a similar summary slide. This one's from the CDC, so it looks a little different than the one from the state of Illinois. But again, this is one of the things that you can go back to. These are where the guidelines come from. They come from the Centers for Disease Control about how to stay safe, why we should all be wearing masks, healthy hand hygiene, et cetera, et cetera. So as we open up into these smaller groups of 10, we need to be really careful about masks, hygiene, social distancing, and whenever possible, doing those things outdoors, because again, outdoors is safer. Next slide. And there are some of the references for these. And again, I refer you back to the Illinois Department of Public Health, has excellent and very easy to understand graphs and data. So thank you for sharing, and later on, I'll be happy to take questions.
Thank you so much, Dr. Burnett, for your time and for being here with us and for advising us as we move through this new time as being church together. We really appreciate it. Now, as we get a chance to kind of absorb what Dr. Burnett has brought forward to us, we are going to move into the Restoring Metropolitan Chicago Synod document. And so you've probably seen it out there. It's a little bit overwhelming. And so let's go ahead and see if I can help to demystify that a little bit and explain what this all looks like for us. So first thing, just a few of the basic groundwork principles to add to what Pastor Severson has already shared with us. First of all, these are guidelines or recommendations. It's really important, and our lawyers have hammered this home, that you are complying with local, state, and federal requirements. So here's a little brief caveat here right now, because we are, as a synod, looking at just Illinois, kind of what it looks like from the state level. So we're not looking at individual towns, townships, or other municipalities. So for example, while the state may be moving into phase 3 here at the end of the week, there have been some initial conversations that the mayor of Chicago has said that Chicago's not quite ready to make that same move. So you're going to need to make sure that you're double checking with also your local kind of municipality and what kind of laws they have in place from that. Right now, from a lawyer perspective, this new phase 3 guidelines that were released by the governor just last week are probably mandatory, although we need to have an executive order, which is expected probably in the next few days or so, to make that more clear. So there's a difference between something being legal and being a law, and then there's something that are guidelines and helpful. Now, however, our lawyer reminds us that from a liability standpoint, even if the guidelines are not mandated by the state, it's entirely likely that they will establish a standard of care. And entities that do not implement that standard of care, to the detriment of the health for the employees or parishioners, they might be found negligent in lawsuits seeking damages. So what's really important is that you're checking in as you're making these steps forward to look at the liability and to talk with your lawyer for your congregation. Now, with that, We also are not trying to create anything new that isn't out there. As Pastor Severson talked about, we have pulled on a lot of the resources that are out there. We also are well aware that there has been very little direct guidance to congregations that have been released thus far. So we are looking at certain things, like, for example, in the guidelines that were just put out by Governor Pritzker, it talks about how in office settings, any kind of nonprofits, which includes churches, needs to follow those office guidelines. So we've tried to go into all the little different things of offices and daycares and the resources from the ELCA and kind of built out that framework, as Pastor Severson noted. Also, we want to just let you know that we're going to continue to update these resources as more information becomes available. You'll already see on the document that was first released on the 22nd, we've gone through and we've yellow highlighted any of those changes that were made when we released the update just this morning. So as we continue to go through that, we're going to highlight that in the main document, so not in the spreadsheets, and we're going to talk more about that in a minute, but you can then just kind of glance at it very quickly to see kind of what new information that we're finding. And again, hopefully you're doing all of your own work with that as well. Finally, one of the things that we keep hearing a little bit about is like, well, these guidelines are not suggesting timeframes. They're not telling us, when we can go back, or what that might look like, or why can't we move faster as a synod? And so really at this point, the governor or your local elected officials, those are the ones who are putting forth kind of the plan or the timeline. What we are doing here as the synod is we're not in control of that timetable, but what we can do is give you some resources as to, as things progress forward, what that could look like for your congregational setting. Now, as the state or local municipalities move into new phases, and they do it at different times, you also as a church don't necessarily need to follow suit right away. So you can take extra time, but we would recommend that you continue to be in communication with your congregation to kind of let them know and avoid confusion as we go through that. And finally, before we move into the steps, these guidelines are necessarily complex. After all, we are moving into our church buildings in the middle of a global pandemic. Unfortunately, this is our new normal. And the good news is that we as church people, we kind of specialize in helping people move into the new normal after momentous transitions happen in their lives. And so we're ready for this. You are equipped to do this work and to walk alongside people. If you're a pastor, you also at your ordination were entrusted with caring for God's people, bearing their burdens, maintaining their confidences, and giving no occasion for false security or illusory hope. At the same time, this is all frame-bending work. And because it is impacting every single aspect of our congregational life together, it requires a lot of detail and thought and concern for the neighbors among us. And so our hope is through this, it can give you a little bit of perspective and help ease that overwhelming feeling. And that you can look into what that looks like for your context. So with that being said, let's go ahead, and if you were to look at the Restoring Metropolitan Chicago Synod resource, you would see that we have kind of 5 movements that we can move through as we figure out what that looks like. And we're going to go through each of them. So first you can see we're encouraging you to read Restore Illinois, to explore these particular guidelines, then to take those guidelines, contextualize them from where exactly you are with your local municipality's guidelines, to then write and develop that plan, and then continually review it and check in. So with that, we are well aware that this is a lot of information we're throwing at you. So there is a step-by-step process on pages 5 and 6 that can guide you through this as well as you go back and look at it. You can also see that in the table of contents that we have, that it kind of naturally guides you through that. So you can see kind of movement 1, 2, 3, 4, 5 are just going to bring you right through that document. And now I want to kind of get a chance to tease apart this document here. And as we're going through that, I've placed little numbers in the bottom left-hand corner that are going along with these different movements that we're suggesting. So that first movement that we're looking at is to read the Restore Illinois framework. And so Dr. Brunette just took us through that Restore Illinois framework, those 5 phases, what that looks like for the different regions. And so after we're grounded in that, then as we have developed our process, these particular guidelines that we have before you are built around this same phasing. So while there are really great resources from different parts of the United States out there, this particular resource is looking at what it means for Illinois in particular. And so as we look at that, you'll notice that it's very similar, Restore Illinois, those 5 phases, and we've also done the same thing for the guidelines that you see there. Now, I want to, because that can be all overwhelming, to look at all 5 phases at once, I'm just going to narrow in really quick on phase 1 here. So you can see phase 1, we've got some categories there. So you've got like protective measures, which is our category, and then some information below that about what is the guideline that the Synod would be giving for that. As you continue to kind of scroll down and look further down that sheet, you're going to see 4, 5, 6, 7, and then you're going to see 8, 9, 10. And so you could just kind of keep looking all down that column to see that. Then you're going to move into an understanding that within each phase, we are always repeating these same 10 main categories throughout every single phase. These were the categories that both the Synod Council and the staff thought were kind of most important for us as congregations to be really mindful of through this. There's also other ones to keep in mind, but these are kind of the main ones. And so those are protective measures, cleaning practices, employment practices, liturgical and sacramental modifications, responding to COVID positive diagnosis, communal food and drink, pastoral care, small groups, meetings, faith formation and child care centers, space use and rentals, and communication practices. Now, if you get to page 8 of the guidelines, you'll notice that it kind of says, oh, well, there's a summary of guidelines, and then there's a Google Sheet version, a PDF version, and then there's the detailed guidelines, and then there's the Google Sheet and PDF versions of that. And so what is going on here with all of that? It can be a little confusing. What is going on here is that the Synod Council really thought that it's important to really dive deep into the different ways that people process information. And so for some of us, that's a little bit more simplified visual. For others of us, that's visual, still kind of in a chart, but kind of with a little bit more detail. And then for others of us, that's maybe bullet points and kind of going through the long form. They're all very, very similar in how they interact, and they actually pair together as well. And so you've got these 3 things working together. They're all connected, they're all interrelated. And so the first way you could kind of look at it is kind of taking an overview, a look, and then going to the specifics. These are for those global learners that are among us, right? So this is for people who want to look at the summary guidelines and say like, okay, I kind of get the gist of what's going on here. Let me dig a little bit deeper. So I'm going to go from that one sheet. I'm going to move over to the detailed guidelines spreadsheet. And then I see, oh gosh, it says something about symptom screening. What in the world does that mean? Well, now I can take from the detailed guidelines and I can move myself over to the operational questions. And that's going to give you some more questions about how you can dig deeper into what that will look like in your context. So again, it kind of starts with the summary guidelines, right? And so we can see this here for protective measures, for example. The summary is very vague. Symptom screening, hand washing and masks, very general, big overview. Then it moves into our detail guidelines. And here you can see in the red box, it tells you a little bit more about the mask wearing. So those over age 2 wear a mask over the mouth and the nose, and we should provide masks for those without. And so it gives a little bit more detail. And then if you wanted to dive even deeper, then you can go into the operational questions. And so it's going to start asking you things like, okay, well, do you have enough masks for these things? And what if somebody comes and they don't have a mask? You know, can you provide it to them? What's the whole process for that? Who's going to check for these things? So on and so forth. So kind of interconnected. So one way is to kind of go overview to specifics. Another way that you could look at this is the opposite. And we're going to go through that in a minute, that you kind of look detailed and go to overview. But just so you can see a little bit more deeply about what we're looking to, so for just that one category under phase 2, here is what a summary guideline would look like. Pretty basic. Then we move into the more detailed guidelines. You can see there's still more kind of coming about with that, giving us some idea of what kind of square footage per person you would need for 6 feet kind of all around them. And then if you moved forward, then you would get into those operational questions that are going to ask you some more detail. You'll even note here that these are some of the yellow highlights that we added, specifically incorporating the guidance that came from Illinois. And so you can see what kind of things are being updated and changing as we go along. Now, I mentioned that you could also use it the opposite way, which for me personally, this is the way that I think. I would rather jump into the details. I want to get all the details in. And once I've got the whole details and everything's working together, I can then back out to those detailed guidelines, which are going to summarize it a little bit more, and then even further to those summary guidelines. So it all just kind of depends on if you want to go in this slide, you want to move right to left, or if you want to move left to right. They're all interconnected. They're all sharing similar information. And you can see with the operational questions right there, the heading, one, protective, matches up across the board. And then for our detailed guidelines, you've got the sanitize hands before entering the building. That's our letter A right there. Sanitize our hands before entering the building with the questions underneath. So if you wanted to just refer to one over, you can do that pretty quickly. And so, as we continue to move forward with this, you also might say, I don't need all that, Pastor Jason. And so you can just jump in right with the operational questions, and that's going to give you everything you need right there. So you don't necessarily need to have the spreadsheets. Those are just helpful things if that's kind of the way that you learn and think through things. Okay, so once we've looked at the Read, Restore Illinois, we've kind of looked at that overall, and then we've begun exploring the guidelines, these 3 interconnected different parts. Then we're going to start contextualizing it. And so we have given some contextual questions on page 19 and page 20 there that are going to help you think about what's going to look like particularly for your context. So rooting your response in your purpose. We all have that common purpose that we share in our constitutions, which aren't the most sexy of documents, but they are really helpful in times of crisis. And so looking at your responding to your purpose, looking at what your local municipalities are saying, considering your liability, and then this is a really important one, looking at your own demographics. On a synod level, we could imagine a congregation that has primarily vulnerable populations that may choose not to enter their building until much, much later on phase 4, and maybe not even until phase 5. On the other end of the spectrum, we could imagine a congregation that looks a little bit more diverse, that is going to look for ways that is going to continuing to live stream, but make sure that you're putting in those really important protective measures for those who want to be present in that situation. So it's really going to depend on your context. So as you begin to look at all of that, okay, so 1, 2, 3, 4, stick with me here. We're almost done. We're in step 4. You're going to write your plan. And we think that it's really important that you write it out, that you put it in writing. There is a lot of information here. And so we would suggest that maybe 2 or 3 people maximum try to build out a plan first. Sit down with everything, comb through it. It's going to take time. Then kind of create a plan, and maybe you would even create your own plan using the worksheet that we have available for you. So looking at all of those 10 different categories there. And so once you've got that plan kind of all figured out there, then you can kind of present that to your key decision makers. It could be the council or others. Make sure that you also have a few people who are working on this, that of those few, that they kind of understand the full operations of what's happening. So for some people, that really might be their pastor. For other people, maybe it's a deacon. Maybe it's also somebody who's like a building operations person. But making sure that you have kind of that global understanding of everything that's going on there. And so when you get to page 21 there and you write out your plan, you can see there are some click links there for the worksheet that's on Google Sheets version or the Excel. And so you can download that and you can just start typing it all right in there to help kind of formulate your thoughts as you're going through that. So then finally getting to that review page. And so we review kind of movement, that final stage where it's really important that you continue to review it. We have a whole list of additional resources and references that you can dig deeper. There's some in the questions there as well. And then we also want to remind you that probably at your council meetings or whoever is making these key decisions, that you're reviewing this pretty regularly. Information seems to change on a daily, sometimes hourly basis, and that is probably likely to continue. So continue to look for that information to change and to be integrated into your plan. With all of that said, you're tired of hearing from me. I'm tired of speaking. So I just have a few final thoughts before we move into our question and answer portion. So as you move into creating your plan, as noted in the plan, we encourage you to err on the side of love for your neighbor, which is both embodied and modeled. So look for those ways that you can do both in this time of pandemic. We are still church. So let's be the church to one another, even as we move into our buildings. Another thing to note is that the lawyers always want to remind us that we will continue to encourage you to look at your local, state, and federal requirements. So continue to look at those local municipalities and what they're bringing there. It can feel really overwhelming, but remember, you're equipped for this. You've got this. You've got this. You've been doing this new normal thing for a long time. It's just going to take a little bit of a pivot for us to understand how we can do this now in this time and place. As a reminder, we're going to continue to update these guidelines with new information that's available, so please check back regularly on them. And if you're in the need of a little bit more support, we encourage you to reach out to your associate to the bishop, and they can give you a little bit more of that individual support, brainstorm ways to contextualize this information, because we are, again, together, we are one church, many expressions, and the Synod is here to help you and your congregations through this difficult time.
Thanks, Pastor Jason, for that engaging and very thorough step-by-step process through how to use these documents. At this point, we have a few questions that have come up, a few as it relates to Dr. Burnett's presentation. One was as it relates to moving from phase 3 to phase 4. You mentioned that contact tracing is important there.
Yes, questions. I can take those questions. The first question was, Chris Wogelman asked, is the number of people allowed at gatherings guided by the greater ability to trace people, or will it really be safer in phase 4? And the answer is the risk to an individual person doesn't change because we move into phase 4. Like the highest risk individuals, those in their late 60s, 70s, 80s, they're still at high risk, and they're not likely going to be going out and shouldn't really be going out to those larger gatherings that begin in phase 4. What happens differently is that on a population level, we have a better understanding of where the virus is, and so better ability to keep people home if they might have been exposed. You know, right now we're still at risk for somebody has it, they don't know it, and we interact with them and we get it, okay? Once you sort of tamp down the virus and you have a better, very rigorous contact tracing, there will be less of that unintended exposure. So I hope that answers the question. It will still require masks and precautions and social distancing. The second question was, why are African Americans more likely to die? That's a very complex question, and there have been very thoughtful articles in New York Times and other places about that. It probably has to do with a number of factors, mostly social and environmental factors. For one thing, some of the lowest paying jobs with highest risk exposures are often jobs that are taken by African American workers. That population may be more likely to ride on public transportation, live in more crowded quarters, live in a condition with multiple people in a household. So it's a number of factors. It's probably more all those social factors, as well as there was not enough testing to begin with. So some of those people at high risk jobs didn't have access to testing, and so there were a number of factors. We're hopefully going to do better, but we really need to build our whole infrastructure better in the long term. Temperature checks. There's a bunch of things that you're going to screen. Pastor Jason, do you want to mention that, temperature checks?
Sure, I'd be happy to mention that. I would say, in an initial version of these guidelines, we did explicitly call out the need or the recommendation to have temperature checks as people are coming in the building. It is from at least the most recent guidelines that have been released by, and Dr. Burnett, please jump in at any point if I'm getting it wrong. The most recent ones from the governor seem to be kind of saying that they're encouraging you to consider doing those temperature checks. There are certain ways that you want to do that and that you're maintaining appropriate precautions of the individual who is conducting that. It is, according to some of the conversations we've had with lawyers, it is at this time permissible for employers to conduct those temperature checks. And so I know for my particular context, at Wicker Park Lutheran Church, we will be doing temperature checks when we reopen. And Dr. Burnett, I don't know if you want to add anything.
Yeah, many places of employment are doing it. The medical center and hospital where I work texts everybody, all the workers, all the patients, any visitors, and there's not very many visitors. Everybody gets checked when you come in with a temperature check. So it's sort of a new normal, like wearing masks.
And I would add to that, if I could just really quick, that in the guidelines, you'll notice that there are some click links to help you develop your symptom screening, as well as there's a symptom screening that the Illinois Department of Commerce, I believe it's called, just recently put out that is pretty clear and detailed as well, that you could easily use for something like that.
Yes. Yeah.
Let's move to the question about outdoor and indoor worship. We have a number of those questions, and whether or not in phase 3 you could do outdoor worship, indoor worship.
Outdoor is great and safer because, first of all, there's more air. The risks are when you're in indoors, the air doesn't circulate. Speaking and singing are high risk activities. That puts a lot of liquid droplets in the air. So when you're outdoors, there's more space for that to go on. You still are wearing masks, but outdoors is a great option. Somebody else asked, are the churches opening Sunday? The current guidelines for most of the state of Illinois, are that we are gathering of 10 people is permissible. So that's not a regular church service for most of us. That's a gathering of 10 people is the upper recommendation of where we're at right now with all precautions.
Yeah, and Dr. Burnett, so for outdoor worship, it would also be for phase 3, it should be 10 or less outdoor, regardless if you're outdoor or indoor, correct?
Yeah, that's correct. Yeah.
There's some more about what types of thermometers, how do you do that while maintaining 6 feet? Temperature checks, that is.
Well, first of all, everybody's wearing a mask, and then, the most of the thermometers that are used are very quick and easy now. Many of them you point at a forehead and so forth. So you do that basically, you may not be technically 6 feet away the whole time, but the longest that it takes to get the thing done is a couple of seconds, which is, not a high risk interaction if you're masked.
And I would also say that in the detailed guidelines, there's a link that's going to bring you over to 3 kind of recommendations that have been put out there. I forget which organization did it. It might be CDC, for how you might do that. Some include, as Dr. Burnett kind of mentioned, just kind of standing back. Others are putting plexiglass between you and reaching around. Others are having people self-administer it at home and then asking about. So there's a lot of different complexity around that, I think.
Continuing still with temperature checks, then discussion about, does this start crossing into the area of HIPAA? While we are not lawyers, we definitely have found out that you should not be recording down this information. It's more of a check yes or no if you are safe and well, or if you are not. And that's a huge piece in that confidentiality.
And there's additional information, again, in the document. You can click on the link, and it's going to take you to a place where it's going to answer some of those very specific employment questions about, how are we best storing this information? What are we hanging on to? What are we not? Especially as we get, as Dr. Burnett talked about, into more contact tracing, hanging on to some of that information of kind of who's around when you're gathering is going to be important to expedite that process.
Let's talk about singing for a second. How will the Synod address singing and writing so that we have a tool to share with the congregation?
So we did address it in writing, that we would encourage you to consider not singing at this time. But Bishop, I don't know if you want to say a little something more strongly. I'm giving the lawyer's response to that.
I think we have to. This is our new normal, and I think what we're balancing is how to make sure we get the information out there, but also protect you in a way that we can. So we don't recommend singing with choirs. There are some recommendations of individuals and how many feet they need to be separated. It is a recommendation from our end. The minute we start talking about mandates, our polity kind of comes into place here. But you should know that it is our recommendation that choral singing should not be taking place just because of the risk that it brings into a worship space.
And Bishop, for clarification, that would be not only choral, but any kind of group singing. So singing hymns together, any group singing. Is that correct?
That's correct.
Question about contact tracing. What kind of information should be gathered and held on to for that?
Well, so it's not the job of the church or the pastor to do the contact tracing itself. But when a case is noted, first of all, that wherever the test was done, that should be forwarded to the Department of Public Health. But also, if cases are noted in your congregation, that information should be shared with the Department of Public Health, if in the city of Chicago, if you're CDPH, if you're in city of Chicago, et cetera. And then they'll have a handle on where are the cases occurring. They'll do the contact tracing. We don't do that.
So they'll just so that I understand, they'll do the actual contacting of people, but we might be asked to provide, say, name and number of people who were in church that day, when that individual who was tested positive was exposed. Is that correct?
That might be the case. They might, yes. I imagine the CDPH, for instance, in Chicago might reach back out to a church to ask that kind of information.
Great. What about gatherings of 10 in separate places on the same property in phase 3?
I suppose if they're not really interacting at all, I mean, are you asking about, okay, this is tricky. If you're asking about like, can we have 10 rooms of 10 people? That sounds like more than a gathering of 10 to me. If you got 100 people come into the building, that's not a gathering of 10 people. So if you're talking about different corners of a big area, that's, maybe a different thing.
I would also just add to that, things to think about, and correct me if I'm wrong, Dr. Burnett, but it's also going to be ventilation systems. So is that blowing from other parts of the building into other parts of the building? Are we sharing common hallways? Are we touching things? That seems like those are important things that would...
Yeah, when you come into the building, there's doorknobs, there's bathrooms. We try to avoid using the bathrooms. You multiply everything once you put a bunch of people in a building.
Great. What about the sharing of Holy Communion?
You have some guidelines for that in your, right?
Yeah, we have provided some guidelines or considerations that need to be kept in place during that. Bishop, do you maybe want to start with this? I think there's maybe like a theological underpinning before I go into that.
Here's what I would just share. I've challenged everyone to do your own indigenous work about how to do this safely. The 6 feet is a barrier for how you can do it, how you can effectively do it. But we've heard of people perhaps looking into drive-through, things like that. again, we're not attorneys and we don't give legal advice. But one of the things that each context has to do is assume that if there's an issue, how might that be responded to from an insurance basis based on practices done within your location. And so we're always trying to give some guidance around that that would help you from a protection position. So if there was a way to share communion, and I'm assuming in this question, we're not talking about virtually, if there was a way to do it, to honor what's been put in place by the state of Illinois, I would say share it with us. We can give you an idea of what we feel about it, but ultimately it's going to be a decision that has to be made locally with each congregation. We want you to honor the practices in place by the state of Illinois.
And I think from what we have written, we just want to hammer home maintaining that 6 feet. So as people are queuing, you got to think about that. People coming forward, ushers, you know, there's a lot of complexity with that. One suggestion has been made, kind of, you know, the having people maybe partake, you know, with a wafer and a juice already pre-placed at their seat before they get there. Everyone's taking it together and they're throwing it out themselves to a touchless trash can on their way out. There's still risk with that, right? I think as you're taking off masks, there becomes more risk.
We've heard about pre-packaged. Some places serve them and having a disinfectant wipe, and you know, with each scenario that we've come up with, there is still some inherent risk. And so again, this is why it has to be a conversation.
Be careful with disinfectants and food. I think as we get more and more with using disinfectants, we want to make sure we use them properly.
Should we prohibit vulnerable populations from attending in-person worship, or just inform them of the risks and let them decide?
I would say, you know, I'm sure this is addressing the guidelines as well, but I would say, you know, our job is to educate people, tell people, show them the graphs. You know, the people, our elders, people 65 and older are at much higher risk. We want them to be safe. You know, so our job is to tell them that and to encourage that behavior. That's my opinion.
This is again one of the tension areas of our polity that I just want to name for you. Again, not an attorney, not giving legal advice, but the minute you start naming different groups and you start excluding them, you have to ask yourself the liability question. Should a claim or a charge be made for your context? So I would challenge you to always reach out to an attorney if a congregation has one, pose questions to your insurance company as well. I would just caution us to pay attention to naming groups, classes, and things of that nature.
So kind of going along with that as well, we have a question about what options are there for leading worship for a pastor who is 68 with controlled type 2 diabetes and sort of vulnerable leadership?
Yeah, so that's a very good question. And there's going to be a lot of people facing questions like that. There's not a clear answer, but an individual who is 68 with diabetes is at higher risk than general population. And the more that individual is around others, the more you raise your risk of exposing yourself to the virus. So that is, you know, I mean, that's true. Both the age and the diabetes raise the risk for that individual. So staying away from gatherings is the protective and healthy thing.
Pastor Jason, will you speak to the guidelines about that?
Yeah, so I would just note in that you'll notice that if you're reviewing both the ELCA's guidelines and the Synod guidelines, you're going to see a little bit of a discrepancy around this, that at least the Synod is not coming out and giving a specific age we're saying, things should be changed. There's questions around kind of employment practices and what are reasonable accommodations that could be made for individuals in particularly vulnerable categories in regard to this virus. So you're going to want to keep that in mind. Talk to your lawyer about those things. Be mindful of that. And I would also add something else that slipped my mind, so it clearly wasn't that important. Bishop, anything to add on that?
I think Dr. Burnett and Pastor Jason are right on with this. I think it's something that we should consider. We have someone in that age group that we know makes themselves more vulnerable, as well as there is a medical situation. We expect that we will be doing more conversations as people develop their own plans. This is a unique situation for a certain context that I would just encourage us to continue to have discussions about. It's awkward, it's weird, but it's not going anywhere. So whether we do the work today or we do it 3 weeks from now, the work must be done for figuring out how will our congregation continue to
A few quick questions maybe about thermometers. Should every church have one to check as you come and go? And how might we help lower economic congregations afford and get a hold of these that are pricey in retail stores?
Yeah, I don't know where to buy them at lower prices. You may reach out to, local hospitals, see if they have, any resources, something like that. But yeah, I think it does make sense to have a thermometer.
And probably ideally a no contact thermometer.
Yeah.
Yeah, and a question that came up that I answered quickly in written was that this, some doctors and medical professionals saying, well, it's too late sometimes by the time you're showing a fever symptom. What is your opinion, Dr. Burnett, about the reliability of that as one of the factors?
Well, if somebody has a fever, they may have a fever and they didn't realize it. That's important to know. If they don't have a fever, you're right, it doesn't tell you that they're safe. But if they have a fever, they shouldn't be there. That's the purpose of doing the fever check.
Thanks. What if some refuse to wear masks? And we're just going to do a couple more questions and wrap this up by 3:15. What if someone refuses to wear masks? How strong should that recommendation be?
I would say it should be strong. Tell the person in a loving way, we are all wearing masks to protect everyone here. And I would make that as clear an expectation as possible and, have others on board. So it's not just one person doing that. And then you can figure out how to escalate it as needed or what to do. But it should be clear, and it should be, of course, it should go like everything else you've said, it should go through your council, through your whole network so that, you build a culture that this is what we do and everybody expects it.
And the mask is a part of the executive order by the governor, which means it is a legal requirement. So there is legal backing to that.
Like the grocery store, you wear a mask.
Yep.
Are the more vulnerable members of our population only at greater risk for contracting the virus or also transmitting the virus?
The more vulnerable members are at risk for having a bad illness and a bad outcome. So we're all basically at the same risk for getting it. Now, who gets sick with it? If you get more sick with it, on average, older people, people with other conditions, certainly people with immune problems. So it's not that an older person is more likely to get infected, it's that they're more likely to end up in the hospital, end up on a ventilator, having trouble, or end up passing away from it.
Do we need to take name and address and number for anyone entering our church?
I don't think that's an expectation.
So the most recent guidelines released by the governor was to say any visitors or anything like that you should be able to have some kind of log of who's coming in or out. So I guess I would encourage and direct you to look at that guidance and to implement it as needed.
Even if it's a log to say someone refused to give you information, you have to have something.
Yeah. And can the Synod review church plans once completed?
What we'd like to do is have you go through your associate to the bishop. And if you're requesting it, we're definitely willing and able to work with conferences. I sent a message to all of the deans that Dr. Burnett was available and making herself available to the conferences as well. So the deans already received that information. So I think if you start out with your associates to the bishop, and then we can figure out what's the best way to move forward. Will Jason be present, or Kyle, or both? Dr. Burnett, myself. So.
Wonderful. Yes, there will be a recording of this presentation available, assuming that the recording worked as we went along, and we'll be uploading it to the Synod's YouTube account. It is 3:15, so we'd like to finish up here quickly. Feel free to reach out again to any one of us panelists and to your associate bishop. The conversation doesn't end today. If you need any assistance, we are here to help walk you through this. We're resources for you and want to help encourage you to be creative as we live into this new reality. So thank you again. Thank you to Bishop Curry for your word, to Dr. Burnett for your wisdom and guidance throughout this whole process, to Pastor Jason for your dedication in the midst of all that you're doing within your own congregation, as well as the other members of the Synod Council who took out time to review our drafts. Just so grateful for all of you during this process. If you have continued questions, feel free to email me. My email is on the Synod website, and I'll help connect us all. Thank you. Have a great day. And it's so wonderful to have been able to be together during this time.
Mm-hmm.